Doc, you said constipation leads to piles.
Yes.
So, how does constipation lead to piles?
I said constipation is the mother of all diseases. I'll explain how it leads to piles. Okay, this is the anal canal. Okay, this is the anal canal, and this is the junction. I've taken a section like this. So in the anal canal, we have something called as a normal anal cushions. These cushions are nothing but collection of blood vessels.
Okay.
These cushions will help in controlling the release of gases and controlling the releases of loose stools. So whenever a patient has got constipation or sits in the washroom for a longer time, more than 10 minutes, takes the mobile to the washroom, when the stool is hard because of pressure, this will bulge in size. This is called as grade 1 piles. So in this grade 1 piles, a particular human being will not know whether he has got grade 1 piles or not. Next, what happens as the time progresses, this bulge will increase in size. It will come out and goes in on its own like this. This is called as grade 2 piles. In this condition, a patient will know that it is coming out and going in. Some people will not feel that it is coming out and going in because they sit in European commode and they're busy with the mobile phones.
Right.
Clear? The next stage is it will come out, it will not go in. We have to push in the hand. That is called as grade 3 piles. Clear? The next is the ultimate one. It comes out. It doesn't go inside. It will always remain outside. And that patient will come as an emergency to hospital. Napoleon lost his war in Battle of Waterloo because of grade 4 piles. He could not sit on his horse's saddle and he lost the war. Piles changed the history of this world. Okay, so there's a grade 1, grade 2, grade 3 and grade 4 piles.
Why does it bleed in piles?
Yeah, in grade 1 and grade 2, sometimes grade 3 also, patients may not bleed. But in grade 4, definitely they will bleed. Why they bleed is when they pass stools, when the stool is coming out from the anal canal like this, because of friction, it bleeds. Because piles is nothing but collection of blood vessels. So it bleeds because when the stool passes, there is friction, and this friction causes bleed.
Doc, is piles painful?
In most of the patients, it will be painless. People will come and tell me, sir, I don't have pain at all, but I have piles. When does pain happen in piles is, for example, there is already a grade 2 pile inside. When they pass a very hard stool, when they strain while passing stools, it will push suddenly outside and there is blood clot outside like this. This is called as thrombosed external piles. Next, when it comes outside completely, when it is grade 4, they can't sit on the chair. I've seen people standing in the car and coming to hospital like this. So that is grade 4 piles. So in piles can be with bleed or without bleed. Piles can be with pain or without pain. Right? So these are different grades of piles.
And what is the cure?
Yeah. How do we treat piles? Now, this is the anal canal. This is the junction. And you have a pile mass which is coming out. And people are pushing in the hand like this. Clear? What we do is using laser fibers. The fiber is passed through like this. And this is ablated. Means this is totally burnt like this. That means bringing the pile back to the normal position. In earlier days, we were removing the pile mass. We should not remove the pile mass now. Why? I told you, if you remove the pile mass, people will get incontinence to gases, incontinence to liquids. That means they will not have control over gases and liquids. So the outdated concept now, we do in lasers, push it back to normal position. It will be 100% cure. It will be painless. It will be bloodless. It's a daycare procedure. They will come in the morning and go back in the evening.
Doc, can you tell me what's external piles?
Yes, piles is of two varieties. I told you the internal piles. I'll tell you what is external piles. If this is the anal canal and if this is the junction, we have small blood vessels in the anal worth, it is called this junction. So when patients put pressure while passing stools, when they pass hard stools, when they sit in the washroom for a long time, this will bulge in size and they are called as external piles. So piles is external, piles is internal.
And how are external piles treated?
External piles, see, internal piles, I told you, we bring the piles to normal position like this here. Correct? The external is waste.
Waste.
It doesn't help in any way. So we remove this external piles by using laser. That's it. Simple removal of external piles by laser. That's it.